What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
What's the best place in the house to hide from ghosts? The living room. Excuse me, waiter. This coffee tastes like mud. Yes, sir. It's fresh ground. Which Jedi always got his brother's hand-me-downs? Obi-Wan Kenobi.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valves, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve, with my little pal Dr. Scott, the traditional Chinese medical practitioner who gives me street cred with the wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
And my partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you got a question you're embarrassed to take to a regular medical provider, can't find an answer anywhere else, give us a call. 347-766-4323. That's 347-2. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcasts, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. Don't forget stuff.drsteve.com. That's stuff.drsteve.com for all of your Amazon needs. Scroll down, see all the stuff that we talk about on the show, or you can just click through to Amazon. It really makes a huge difference. And then tweakedaudio.com, offer code FLUID for the best earbuds for the price. And with offer code FLUID, you get 33% off. They got great customer service. And Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. Check Tacie and I out at patreon.com/weirdmedicine. Tomorrow, we'll be recording the Gino Bisconti interview, where he's going to apparently try to convince me that all of this COVID stuff is a conspiracy. So that'll be interesting. And we're going to try to talk science with Gino. And he just doesn't want people to call him a wackadoo, and that's fine. We can do that as long as we can discuss the pros and cons of the scientific method. And then if you want me to say fluid to your mama, give me a shout at cameo.com/weirdmedicine. You know, I used to work at WRAL TV in Raleigh, North Carolina. We did a show called Mid-Atlantic Championship Wrestling, and we had Wahoo McDaniel and Ric Flair and who else did we have? We had Greg Valentine, Mr. Wrestling Tim Woods, Ricky Steamboat, but we also had a guy named Baron von Raschke. And he had a finishing move called the Claw, and he would put his hands over your head like that, and it was called the Claw, and then you would go out. And it was an illegal move, but the ref was never watching, all that stuff. So Baron von Raschke was hilarious, and he was Mighty Igor Polish Prince's partner, and we've talked about that before. And I got, for Christmas, I got Vinnie Paulino a cameo from Baron von Raschke, and he was delighted. He's 1,000 years old.
Looks like he's still around.
Looks like a real skinny Tor Johnson now, but he did a great cameo. Matter of fact, I guess since I mentioned it, I should probably play it, shouldn't I? Oh, is that bad?
No.
Okay, here we go. Okay. Uh-oh.
No, it's not Santa Claus. It's not George.
Okay, so Baron von Raschke is got a Santa hat on and a Santa scarf.
Tony dressed up to look like Santa Claus. No, this is Baron von Raschke. That's right. The Claw, not Santa Claus, the Claw. And Dr. Steve wanted me to tell one of his best friends, Vinny the Bear Paulino. I wrestled a bear one time. Well, many times actually. His name was Ted. I don't know his last name. But anyway, back in those days, I was in shape. I could go anywhere, I could do anything, and I could wrestle anybody. And I'll tell you something, Dr. Steve has asked me to give you my workout program. Well, I got up early. I went out for a run. I went back, ate a good hearty breakfast.
This is just, I said, Vinny's fat. Can you help him with his workout program?
Then I started to do push-ups. I did set-ups, good for the abs. Do the set-ups, maybe push a little weight for the pecs. And that is just the start. And then you go out and you maybe take a long walk. But there are a lot of ways to get in shape. It's got to suit you. So, Vinny...
It's actually really good advice.
The Bear Paulino, those are my words of advice. Sage words from the Claw. And that is all the people need to know. Jingly bells, jingle all.
Okay, all right. Thanks, Baron. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And I do want to announce the birthday of Mr. Cardiff Electric.
Stop. Stop it right now.
Tried to slip that one by you there. Taste.
Almost.
I don't usually pay attention, but I caught that one.
Well, I'll try to slip it in later. I know. When I see Tacie on her phone, just wink at me, Scott, and I'll slip in the
She'll never know.
Announcement. Okay. So, we've got some things. We've got a question or two, obviously, about Damar Hamlin. I was supposed to be on Anthony and then on Gino Bisconti's show and a couple other ones, and I just was so busy this week I didn't have an opportunity to talk about it. Mm-hmm. We can just go ahead and get this out of the way now. I think that's the thing that people are really interested in. Let's see.
Hey, Dr. Steve, it's Matt Charleston.
Hey, Matt.
I'm calling to ask you about Damar Hamlin,
the
Buffalo Bills player who was hit Monday Night Football game. Got up from the hit, stumbled, and then collapsed at cardiac arrest. Heard about this happening in other contact sports like hockey.
Sure.
And wondering if you can talk about that.
Yeah, absolutely. Thanks. We were going to talk about it anyway, but it's always nice to have a phone call.
Like a real question.
Yeah, that's
a real
right.
question.
It's like a real radio show. Yeah. So when I saw it happen, I kind of knew I didn't know anything, but I had a real good idea that what had happened was a thing called Commotio Cordis. And that is so you've seen people, have you seen the movie The Abyss?
No.
Okay, so they do a code blue in the movie The Abyss, completely unrealistic, but a lot of people have seen that. You've got Ed Harris and Mary Elizabeth Mastrantonio over on one side in a submarine a mile down or some ridiculous amount.
Stop, it's enough.
And then they have to get from one submarine to the other.
Yeah.
But they only have one pressure suit.
Ugh.
So she says, just take me over there, I'll die, but then you can resuscitate me on the other side, which is a pretty cool plot point. Of course, she was the smart one. And so he does that, and you see her, halfway through. She's, underwater, and then she dies. When they get her up there, she's dead. But the thing that is apropos to this is he does a thing called a chest thump. Now, in movies, they pound on people's chests and, thong, 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 breathe, damn you, breathe. And then, the people goes, and coughs up water and stuff. But the chest thump itself, so that's fake. But the chest thump itself is real because the heart has the ability to, or one of the characteristics of the heart is that when you poke on it with the right sort of amplitude, you can generate an electrical impulse.
Gotcha.
It's almost like it's almost piezoelectric.
Right.
You have these crystals, and if you thump them, they make an electric current. So this is a different mechanism, but kind of the same thing. So the chest thump is a real thing.
Right.
And if you do it at the right amplitude at exactly the wrong time, what happens is you generate an impulse that cancels out the electrical current in the heart. Now you go, well, how in the hell could it do that? Well, let's talk about that just for a second. The top part of the heart, the atria, and the right atrium of the heart is a little thing called the
atrioventricular node. Wait a minute. Go ahead and give me a bill right now. I'll take it. I'll take it.
We'll take it. Yep.
One
Very
is
good.
it, baby.
Very good. You got one bail.
Yes.
And it's basically the pacemaker of the heart. So it will contract, it creates a current that flows from that node to a thing called the sinoatrial node.
Okay.
And wait a minute. The atrioventricular node. We were just talking about the sinoatrial node. So anyway, you've got this sinus node. It fires, and that contracts the top part of the heart. That's the lub, and then it sends this electrical signal to the atrioventricular node, which then has fibers that go all the way down around the bottom of the heart, and it starts to contract from the bottom up.
Right.
But the impulse goes from the top down. Now it's got to repolarize, which means that the current's got to go in the opposite direction to get the heart ready to do this again. So top part is lub, bottom part is dub. You hear the lub dub. Okay, right? So if you hit the heart in such a way that you generate an impulse going in the opposite direction of that impulse that's coming from the atrioventricular node to the ventricle. Okay, so you've got current going in one direction. Now you hit the person just at the right time, just at the wrong place. Right. And now you've got current going in the opposite direction. Those two currents will cancel each other out. And then the heart's just sitting there going, now what the fuck do I do?
Yeah.
It doesn't know what to do.
No. Out of sync completely.
And when that happens, you get a beat called, a rhythm called ventricular fibrillation. And ventricular fibrillation is where the heart is just sort of like, if you've ever seen one, it looks like a bag of worms. It's not contracting in any kind of functional way. And it's just jiggling like Jell-O. And when that happens, now nothing happens, and there's no blood being pumped, and that is a so-called, pulseless cardiac arrest. And, we see this in hockey, see it in baseball.
Yes.
And it's always just a freak
accident. Yeah.
If it were really easy to induce, we'd see it all the time in baseball.
Right.
And not so much baseball. In football, we would see it all the time, and in rugby, and in to a lesser extent soccer.
Well, and even martial arts, mixed martial arts.
Sure, if you're
people
taking
getting kicked or punched in the chest,
because all of that would be outlawed if this was
right.
And
easily done. Yeah.
One thing I'm concerned about, and this is kind of off topic, is now that we've had. We should look at. When you look up the incidence of Commotio cordis on the football field, I just wonder how many other times this has happened.
I can tell you, I've only seen it in baseball. I've seen Little League baseball players occasionally, and which is a terrible thing.
Yeah,
because typically in a Little League setting that happens, and the outcomes are really poor.
Well, and you don't have ambulances standing by.
Yeah, that's my point. Yeah,
and all that stuff. You have to call 911. So. One of the things that we look at when this happens is how quickly was circulation, artificial circulation started. So how quickly do you do CPR? And chest compressions have been shown to push blood around enough that you can keep the brain alive, and because that's your goal. And then you want to get that heart rhythm back to normal as soon as you can. Could you find anything?
I can't spell it right.
Okay. Well, it's okay. Just
I spelled it so wrong that it says.
I don't know what that is.
Yeah.
Okay. It just incidents of cardiac arrest football. Just do that.
Well, that would have been.
Okay. I said it wrong. Sorry.
Yeah.
So, anyway, so you want to to get to the person quickly, which they did with him, and get return of spontaneous circulation as quick as possible, which apparently they did. I think it took a couple of times, and but they did everything right. They put him in the ICU. I'm assuming that they did a hypothermic treatment because patients do better. There's some evidence that when this happens, you can preserve tissue better when the patient's body is cooled down. And we know that people that fall into cold lakes can be resuscitated after, 30 minutes of drowning, sometimes 45 if they're a kid. Yeah, Tace, what'd you find?
Okay, so this says, this is a study, and it cited an estimate that sudden cardiac death incidents range from 1 to 40,000 to 1 in 80,000 athletes per year.
Okay, so how many athletes are there in the NFL? We should be able to figure this out.
Yeah,
well, just
a couple thousand, yeah.
Echo, how many football players are there in the NFL?
There are 2,557 NFL active football players.
Okay, so there's, say, 2,000, and you said 1 in 80,000 per year?
Well, it's really stupid what it says because it said 1 in 40,000.
Okay, it's 40
to
80,000.
1 in 80,000. So, I mean, I could have come up with that just out of my
that's
butt.
kind of a wide range.
Yeah, a little bit.
Well, that just means that the numbers are so small that they can't give you a real accurate number. So let's say 1 in 60,000 then, right? So there's 2,000. And so what's that? It'd be 1 every 30 years is what we're looking at, right? Is that right? 1 in every 60,000 per year. And there's 2,000 players. Scott, right? Yeah, nobody's looking
I'm
at
not
that.
doing math. I'm not doing math.
Fine.
I don't work
So
anymore.
we would expect a 1 every 30 to 60 years. That's why it's so infrequent. Yeah, go ahead.
So did he die, technically?
Well, I mean, okay, so that's a great damn question because how do we define death? In the old days, we used to define death as cessation of breathing. When you stop breathing, you were dead. And then what happened was we invented ventilators and mouth-to-mouth and stuff, and we learned that just stopping breathing doesn't mean you're dead. We just need to keep you breathing, so we put you on the ventilator. Then it was if your heart stopped. you're dead. We would declare people dead when their heart stopped. Well, then we developed CPR and the old chest thump. One of the things that could have brought him out of this, had they had nothing, was another chest thump.
Right.
That's the
Try to
interesting
kick it back
thing.
into rhythm.
Yeah, just to kick it back into rhythm. Anyway, so we developed the advanced cardiac life support. When I say we, smarter people than I did, protocol, and people like, Brian from BPS Radio / the Radio Freaks, who do that every day, resuscitate people every day. The average survival when you have an 18-year-old, say, basketball player who has CPR is right around 17%. But it really that's average, and it has a lot to do, again, with how quickly you get on it. And when you've got a football player that's surrounded with medical personnel, you're in better shape if this happens. Yeah, Tace.
I did find some smaller numbers. It says, according to a 2016 study, and this is from BBC.com,
okay,
there are approximately 100 to 150 sudden cardiac deaths each year during competitive sports in the U.S. alone.
So that would be what Scott was talking about, Little League, football,
All
regular
of it.
football, everything.
Yeah, but I don't think that. I think I would like to see the incidence of the actual cardiac events due to the thump. Yeah. Because most of them, are not.
Some of them are congenital heart disease.
Most of them have congenital heart disease, or they blow a clot or something like that. So it's a little different.
Give yourself a bill.
That's two.
Yeah, I'm up two, baby.
So anyway,
big difference. A big difference in the different types of cardiac events.
And by the way, if you've got kids, don't blow off that physical exam, because that's where they catch these things. And this stuff does happen, where kids just get passed through, and then they end up in highly competitive high school or college sports, and with a congenital heart illness that takes them out of this world. So,
what's the youngest you've ever seen a heart attack or cardiac event in somebody?
Oh boy, I don't know. Pretty young.
Yeah,
what do you think?
Well, I was going to say I saw one when we were in Houston, and he was 16.
Oh my goodness!
Had just a normal MI. Had showed all the normal signs and symptoms, and everybody's like, well, I mean, we saw him after.
Do they know what caused it?
It was congenital, some kind of resonant defect.
Because with the diet that kids eat these days, they have found some kids that have atherosclerosis of their hearts at very young ages. I worry a little bit about our kids on that, because their diet is not as robust as I would like for it to be. But anyway, so they got to him quickly. Now, when you have someone in the ICU, you don't know if you sedate them and you put them on a hypothermic protocol and you cool them down and then you wait. And one of the things that we use to determine whether someone's going to do well is a thing called the Levy scale. And Levy took 1,000 people that came in with cardiac arrest and looked at lots of different criteria, and then developed what we call a multivariate analysis of conditions or signs or symptoms that would lead to a bad outcome. And so you look at people at day 1, day 3, and day 7. And without going through the whole Levy protocol, and this isn't the Levy protocol we all know, where you stop smoking for 3 days and then you start smoking again. That's a different Levy protocol. That's the Bob Levy protocol. But the most important criteria of this is if the patient is following commands on day 7. That's a very good indicator of excellent prognosis. There are a lot of indicators of bad prognosis.
Sure.
One of those being disconjugate gaze. In other words, that they're not able to, their eyes are just sort of floating around.
Can't focus.
The roving conjugate gaze on the first day, you may have a good outcome with those. But this, Damar was following commands and signaling and actually communicating at on day 5, I think, day 4 or 5, I'm not sure. Obviously, I wasn't there. I'm just going by what I'm reading. So those are all really good signs for good outcome. It says here, just 4 days after his stunning on-field cardiac arrest, Buffalo Bills safety Damar Hamlin is breathing on his own and speaking to his family, physicians, and teammates. So, again, all signs of
he was 48 hours, couldn't talk, but was actually answering questions via writing and moving his hands and toes.
Yeah, well, he probably had to. He was probably endotracheal.
He was intubated. Yeah,
he was intubated, so he had a tube going from the outside to the inside of his lungs.
Yeah, I think they just took him off the ventilator on Friday.
I don't know.
Thursday.
I don't know. I wasn't there, so.
I saw it on the internet. But anyway, that's got to be right.
So, but that's how we look at these things. Is there are other? There's blood tests that you can do. There's a serum neuron enolase, and you can do that, and it's a sign of bad outcome. If it's elevated, the problem with it is in our hospital, it takes 2 weeks to get back. So by then you already know. So what you're really looking at are clinical things like this. So the Levy scale is one you could just look at the patient, do a very simple physical exam, and you get a pretty good idea of what their outcome is going to be. So they would have done that, and that's good news. So good for him. I'm glad. And what I'm concerned about is the way that the NFL does things. They ignore some stuff and then they knee-jerk other things. And I'm afraid that they're going to, now require some sort of sternal protection or something like that for something that happens one time in 60 years.
Yeah.
But it is 100 people. Would you say 100, 150 Tace, something like that?
Yeah, I believe
every
so.
year. I mean, we got a population of 350 million. The odds that that's going to happen to you are small, but still that's 100 tragedies. People just going out to play a sport and have some fun or make a living, and then the next thing you know, this happens. So. Anywho, but that's what it was. I've heard people say, well, he got vaccinated. Well, okay, there's 2 people on that team that didn't get vaccinated. Let's not make this about the vaccine at this point.
The article also spoke about that.
Oh, it did?
Yeah, just a little bit.
Well, what did it say?
Well, let me get my glasses on.
Okay, don't worry about it. It's okay.
Let me pull it up.
If there was no sign of myocarditis in him ahead of time, then this didn't have anything.
Probably unrelated.
Yeah, and somebody sent me a graphic, and it said, look at all the different things that happen from the VAERS database. Are you familiar with the VAERS database? It's the Vaccine Adverse Event database, and you can report that. I can report anything I want. I really, you could, I could report my lung thing and say, I don't know that the vaccine didn't cause that, and it would go into the database. Yeah, Tace.
Okay, so I found it. Anti-vaccination activists online jumped on the news of Hamlin's collapse to blame without evidence.
Well, we didn't have any evidence
one
of
account
anything.
Promoting a viral anti-COVID vaccination film full of dubious and debunked claims, tweeted that prior to 2021, athletes collapsing on the field was not a normal event. This is becoming
it's not normal now.
Undeniable and an extremely concerning pattern.
Okay, where's the pattern? Am I unaware of other people like this happening?
Then it says anti-vaccine activists have collected a number of anecdotal reports of athlete deaths in order to bolster their claims.
Okay, so I listen. Fine, I think that's great. We should. What we shouldn't do is just say, well, there are a bunch of effing crackpots, even if they may seem that way, because we don't want to shut people up. We did enough of that over the last couple of years. We want to have a discussion about it. If they'll have a discussion, if they won't, then then it's faith-based.
It also says though that his vaccination status is unknown.
Well, okay. My understanding is that everybody on the team was vaccinated except for 2 people.
Okay.
And those 2 people weren't him. But I don't know if that's true either. But it doesn't matter. Here's the thing. How would we determine whether this is vaccine related? We would want to go back and see if this is unusual. Is there something going on where we actually are seeing more people keeling over on the football field with sudden cardiac arrest than we did before 2019. Okay. And then if you do see a preponderance, then you want to take away all of the different variables that you can. Are more people smoking because of the thing? Are more people eating different things? Are there people's cholesterols? Did they miss appointments because of the pandemic and because of telehealth? Oh, you got to take all that stuff out. And then was there any evidence of myocarditis? If he had tragically passed away, they would have done an autopsy, would have been able to tell that. Thank God that didn't happen. Sure. But, for some of the ones that do pass away, is that, because the thing is myocarditis. That's what you're worried about.
After a vaccine.
After the vaccine, right. But here's the thing. So I got this VAERS data thing sent to me, and it's here's myocarditis, there's cancer, there's all kinds of adverse events that are associated with the vaccine. And then you look at the data. You know what else causes myocarditis? COVID-19 does. And it does it at a higher rate, and it's more severe than when you get the vaccine. So now what some people say is, okay, well, maybe I can avoid getting COVID-19, but if I take the vaccine on purpose, then I'm exposing myself to risk. I understand that. I'm not in favor of mandating this vaccine. I just want us to have a rational discussion about the risk, benefits, and alternatives. Because it is, anything that's emergency, under an emergency authorization, I don't think that should be mandated. At least not with the lethality of this virus. Right. Maybe if we had an Ebola type virus that could be transmitted by speaking to other people, then we might want to mandate an emergency vaccine. But hopefully we'll have something for that before that. But I do want to talk about the science in a rational way, and just showing up a graphic. Look at all the things that happen after the vaccine, and one of them is cancer. And it's like, well, where did that come from? It's just because somebody reported 2 years after I got the vaccine, I also got cancer, and they throw it in there because they have to. Right. That's how that thing works. The VAERS database is self-reported, and all it's good for. It's not good for this conversation that people are having. All it is good for is to alert researchers that there may be something, and to go do an actual study, to see a real study, a scientific study. And, this kind of thing happened with, autism, with kids, the MMR vaccines and stuff. And the VAERS database started blowing up with cases of autism that was purportedly related to the MMR vaccine. So they spent the money and did the actual studies, and found that there wasn't a real effect there.
You don't hear about that much anymore.
No. Well, and the thing is it turned out that a lot of it was that they were making the diagnosis more often. Okay. And so it seemed like there was an uptick. But if you went back to the original criteria of autism, there probably wasn't any uptick at all, other than just tracking the population growth. So pretty interesting.
Yeah, and I would be interested to see too, and when these things you would have to tease out, other than the vaccine being part of athletes having cardiac events. Supplements, specifically like caffeine. Athletes taking extra caffeine before games to get hyped up or whatever. So there's a lot of other.
It's all kinds of things. Stuff.
There's all kinds.
You have to control for all these variables, right. And again, if there is an epidemic of people keeling over like this, then I'm not aware of it. I'm not saying it's not happening, but show me the evidence, because I'm not seeing any numbers that show that there's some sort of concerning uptick in this kind of thing. This kind of thing just sucks when it happens. And, if the sad thing is, if it had been one of the two guys that hadn't been vaccinated, then that would have gotten blamed by the other side. And it's like, it is sad that to have a balanced viewpoint in this world right now, you have to balance two kind of really extreme ways of looking at things. Yeah. And when really the data will tell us what we want to know. And we've talked about last time that if you go back and listen to that show, that you can use statistics in such a way that you can be right and argue completely opposite things. Because we talked about relative risk versus absolute risk. When it comes to natural immunity versus vaccine immunity, people that had vaccines with natural immunity and other people that just had natural immunity alone. And you could say, well, yeah, there was a 33% decrease in, adverse outcomes. And you'd say, oh, well, that's 30%, so you should get the vaccine. But then the anti-vaccine people would say, yeah, but the relative risk was 0.0001 or something, Mm-hmm. So those two things are both true, mm-hmm. and you can argue whichever thing that you believe in. And that's what I don't like about this, the situation that we're in, because we are arguing based on what we believe in rather than believing things after it's demonstrated by the data. But anyway, there you go. It's just called bias. And we have become biased because this whole thing became politicized, because that's just what we do now. Anyway, I'm glad he's doing well as of this recording. He is progressing, and I would expect, barring that there's some neurologic deficit that we are not aware of, that he's going to make a full recovery. Certainly hope so.
They said this morning he's neurologically intact.
Okay, good deal.
Good, yeah.
All right. I have one that's sort of apropos to this. Association, if I say apropos one more time, I don't know why that word's in my head. This is related story. Association between meatless diet and depressive episodes. A cross-sectional analysis of baseline data from the longitudinal study of adult health. And I'm going to give you a clue here in a minute that will tell you what the right answer is, but you won't know it until you look at this. So what they're saying is they looked at 14,000 people aged 35 to 74 years, and they defined a meatless diet as, through this thing called a food frequency questionnaire, which is another validated instrument. Somebody thought that up and got validated the damn thing, and probably got it named after themselves. But anyway, they found a positive association between the prevalence of depressive episodes and a meatless diet. Meat non-consumers experienced approximately twice the frequency of depressive episodes of meat consumers. Now, here we go. So this is their conclusion. That was the results. Depressive episodes are more prevalent in individuals who do not eat meat, independently of socioeconomic and lifestyle factors. Nutrient deficiencies do not explain this association, because they couldn't find any, at least the ones that they looked for. The nature of the association remains unclear. Longitudinal data are needed to clarify a causal relationship. Okay, so they're saying there's an association, not necessarily causation. Now, what if I told you that this study was done in Brazil? Would that help to explain things for you? What questions would you ask in that situation?
Every time I've been to a Brazilian restaurant, there's one thing on the menu, basically.
What is that one thing?
Different kinds of meat.
Give yourself a bill.
Damn it. Yeah. They
2-to-1, buddy.
They can't go out and eat anywhere. So one of the questions you might ask is, what is the prevalence of vegetarianism in Brazil? Yeah. It's like 0.05% of the population. So to me, that's your answer. These people feel completely overwhelmed by the rest of the
outcasts,
population.
They are
outcasts. It'd be really interesting if you did this in, say, Norway or even in the United States, if you got this sort of a strong association. So this is most likely cultural, not physiologic. So but I said in my Twitter analysis of this, watch for the clickbait titles, because they're coming, and you'll see, vegan diet,
leads
to
to
depression and all this kind of bullshit. So. Isn't that interesting?
That's hilarious.
Yeah, and this was done in the Journal of Affective Disorders. So I don't know who these people were, if they're psychologists. I don't see any initials after their name, so it's hard to say. So I don't know. So these were not nutritionists doing this or anyone.
Oh, I'm sure if they had initials, they'd put them there.
I think you're right. I don't know. None of them had initials, so I don't know. Maybe they just don't put initials in that journal. Then.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to Snacks and Wet Napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Sergeant and Mr. Smith, you're gonna love this house.
Bunk beds in a closet?
There's no field manual for finding the right home. But when you do, USAA Homeowners Insurance can help protect it the right way. Restrictions apply.
Hear that? Yeah, that's the sound of you relaxing, because now you're managing diabetes with the Freestyle Libre 3 system. You get to know your glucose levels and where it's headed. Manage your diabetes with more confidence with the Freestyle Libre 3 system. Ready to learn more about the #1 prescribed CGM in the U.S.? Visit freestylelibre.us to learn more. Based on retail sales data for patients' last filled prescription by manufacturer. Refer to the FLAIR NL4 study published in BMJ Open Diabetes Research and Care 2019. Safety info found at freestylelibre.us.
Introducing our biggest GMC Acadia ever. Offering bigger screens, bigger views, and even bigger journeys. Live your biggest life in the all-new GMC Acadia.
All right. Now I have one other news story that's pretty interesting. For those that followed the very early COVID sit reps that I did on YouTube, this is something I've been calling for a very long time. And this is from the New England Journal of Medicine, not some crappy journal from December 28th. VV116 versus Nirmatrelvir-Ritonavir for oral treatment of COVID-19 is the title. What this is a drug that was compared to Paxlovid. Okay, so Paxlovid is the pill that you can take, or the combination of pills that you can take for COVID-19, and it prevents hospitalization about 90% of the time in people who are at risk.
Okay.
The problem with it is I'm always very hesitant to write it, particularly for people who are on lots of medications, because there are a lot of adverse drug interactions. So then you go, well, we'll use molnupiravir, which is very well tolerated, has very few drug interactions, and it's just one pill instead of a bunch of, or a couple of pills that you have to take concurrently. But the problem with molnupiravir is it only prevents 30% of hospitalizations compared to placebo when given to people at high risk. Now, molnupiravir is a great one if you just want to knock it out quickly and you're not at high risk. If you can get somebody to write it for you, because the symptoms go away pretty quick on that one. But as far as people who are morbidly obese or over 65 or having autoimmune disorders, it's really a 30% reduction in hospitalizations, which we would have taken early on.
Oh, heck yeah.
You know, I was a big proponent of favipiravir, the Fuji drug. I think that one got politicized to death. And when I mean politicized, corporate politicized, because Fuji wasn't a major player in pharmaceutical space.
Gotcha.
But and then all of a sudden, here comes molnupiravir from Pfizer, and it hits the market, and we never heard of favipiravir again. Neither here nor there. Anyway, this VV116 is very well tolerated, better tolerated than the Paxlovid, and with fewer adverse events and fewer drug interactions, and it works just as well. So now we have yet another pill that we can give people, and this one will probably take over just because it's simpler to take, and it is, you don't have to worry about it as much when you write the prescription that someone's going to have a problem with it. Yes.
So it's ready to write? It's been approved?
No, it's phase 3.
Okay.
But phase 3 means that they've tested this on, let me see how many people. It should be tens of thousands of people. Well,
it appears to be pretty safe.
Okay, sorry. Well, in this one, it's a pretty small phase 3 trial, 822 participants. But you know why they could get away with doing such a small phase 3 trial? Because they've already done a huge phase 4 trial, because this stuff is oral remdesivir. So remdesivir was the first drug that came out, if you remember, and we were giving it to people right and left in the ICU, and it was disappointing. I wouldn't say it was an utter failure, but it was definitely disappointing and wasn't the panacea we were hoping for. But what we argued on this show multiple times was that they're giving it to the wrong population. They're giving it to the people when they're at death's door, rather than giving it to people early in the course of the illness to prevent them from progressing that far. Mm-hmm. So some WAGs did a study on IV remdesivir in the outpatient setting in people with mild to moderate disease, which is what I had. That's the stage of disease I had. You know, my oxygen was starting to decline. And they were giving it to them in the outpatient to see if it prevented hospitalization and death. And there you go, 80 to 90%. It was as good as the monoclonal antibodies, but it didn't vanish in effectiveness when the virus mutated. That's the problem. The original Regeneron, which is what I got, is worthless now. Okay. You know, against these new strains. But IV early remdesivir still works great. Mm-hmm. And Paxlovid and molnupiravir all have the same efficacy that they ever did, because they're not contingent on that spike protein being a certain way. They work on destroying the life cycle of the virus, which is different. Okay, so
gotcha.
Now, but the problem with IV remdesivir, I tried to get an IV outpatient remdesivir clinic going here, when we could see all of a sudden we would buy all these monoclonal antibodies and they just quit working. You've just got thousands of dollars of stock sitting there, just totally worthless. Let's get an IV remdesivir thing going. Well, the problem with that was they had to come, I think, if I remember correctly, they would have to come twice a day for like 3 to 4 days in a row and get IV infusions. Pain in the ass. Yeah. You got thousands and thousands of people with it. It was really hard to do. Yep. So we're always hoping that an oral version would come out, and now we've got this phase 3 trial that shows that it is just as good as Paxlovid with fewer adverse effects. So I think this is a great drug. I had people say, well, didn't we hear remdesivir was a bust? And it's like, yeah, in the ICU, not so great. But in the outpatient setting, it's the stuff.
Well, so far it looks good, but phase 3 doesn't necessarily mean it's going to get approved, which is why I'm retired at this moment.
That is correct. You're absolutely right. It says time to sustain symptom resolution did not differ substantially between the two groups. No participant in either group died or had progression to severe COVID-19 by day 28. and the incidence of adverse events was lower in the VV116 group than in the nirmatrelvir-ritonavir group. So the reason I think that this probably will come out is because remdesivir is already out, and if they show that it's not inferior to Paxlovid, which is all they're looking at on this, that it'll be pretty quick that they'll. But I would like to see a real FDA just approval of this drug. And I'm not advocating that they should do that. I'm saying I would like to see that it goes through all the steps and they're actually able to do a real FDA approval of this. Because if it works for COVID-19, it probably works for the other common colds as well. And wouldn't it be nice if you, finally, instead of going when you have a cold and you go to your primary care and demand an antibiotic, which we know isn't going to do shit, that you could actually demand
an antiviral,
that would be safe and effective, and it would knock the common cold out in a couple of days instead of 2 weeks.
Heck yeah, it'd be wonderful.
It'd be fantastic.
It would.
So I'm really hoping for this one to do something. Anyway, all right, that's all the news I've got. You guys got anything? Well, this is a news episode, I guess. I've got some calls, though. You want?
Let's do calls.
Do you have anything, Tace?
No.
Okay, all right, very good.
Number one thing, don't take advice from some asshole on the radio.
All right, here's a good one for Dr. Scott, actually.
Hi, Dr. Steve, Dr. Scott.
Hey.
Hope y'all are doing great.
Hey, thanks.
How's
man.
it going?
Good, good. How are you?
Sweet. This is John from Chicago again.
All right. Man.
Hey, random, funny, just lighthearted question to Dr. Scott. So, would you be a traditional Chinese medical practitioner if you're in China? Do they just call you normal, or are they like he's a weirdo?
He's still weird. That's what he was going to say. Like you are here. Are you weird there like you are here? Scott would be weird in China.
Weird
but
anywhere,
if you were a traditional Chinese medicine provider in China, are you considered, people look at you sideways? I know the answer to this. But
nope.
Yeah, they really don't.
No, they really don't. Yeah.
Do you know the percentage of people that consult traditional Chinese medicine in China?
Nope.
It's about 60%.
Is it? Yeah. Yeah, I know the Western medicine hospitals over there are fabulous.
Very well established, and but people still will use it and traditional Chinese medicine at the same time.
Use the combination. So yes, I'm weird throughout the
Yeah, he would be weird throughout the universe. That's right. Even in parallel universes.
Yes, even in my parallel universe.
I don't even think there's one where like Scott would be normal, and that's hard to do.
That's exactly right.
All right. Let's see.
Hi, Dr. Steve.
Hey.
Dr. Scott, if you're there.
Hey, man.
Tacie, hello.
Hello.
Hope y'all are doing wonderful.
Oh,
this
my
is
God.
John from Chicago.
Did you hear how he said that? He's adopting how Stacey
Oh,
Deloach said
no.
it. Did you hear that?
Let's not start that.
Yeah, please,
no.
guys.
There, Tacie, hello. Hope y'all are doing wonderful. This is John from Chicago. Love the show. Thanks for
same
taking
guy.
my questions, putting them on the podcast. Appreciate it.
Yeah, man.
Question about, I guess, drug use. And this is not to condone drug
That's
use,
okay.
and I'm sure
We get it.
y'all would not do that as well. But what's the least, in general, I mean, in your medical opinion, what's the least caustic method that people use to get drugs into their body?
Well, it depends on the drug, but I would say the oral route. If you snort stuff up your nose, long enough, I mean, look at Artie Lang, that's what can happen.
Mm-hmm.
You can lose the cartilage in your nose. IVs.
And ultimately, your veins are going to break down.
And you may inject bacteria into your bloodstream, and then, or even worse, fungus and stuff. Yeah. So you end up with a fungemia or something. Taking it up the ass we've already discussed why that's stupid. You can't control the intake. Yeah. So when we're going to say drugs, I'm not going to talk about illicit drugs because there are some that are just caustic on their on their surface. One of those being crocodile, which is a version of heroin that's made from codeine that's extremely caustic. And when you can't get heroin, people will use it, but it will turn their skin. It causes so much inflammation that it thickens the skin, makes it look like crocodile's skin. That's where it gets its name. But so we'll just talk about alcohol. Alcohol is a drug. So don't put it under your eyelid. Don't snort it up your nose. And don't shove it up your ass.
Mm-hmm.
Just drink it. and drink responsibly if you're going to drink. And then that's it, really, to me. Smoking is going to always be more caustic, no matter. Even vaping is still, I have issues with turning something into a vapor and taking it into your lungs, although done with the proper drug delivery system, we're going to be using inhaled drugs to increase bioavailability and increase onset of action and stuff like that. There may be an inhaled insulin coming down the pike. What we have to determine is if you're going to do it every day, in and out, in and out, in and out, that's one thing. If you just need to get something into somebody's system quickly and you don't have time to do an IV, there are delivery systems that will allow you, and these are experimental, I still haven't seen them hit the market, to give it to somebody in an inhaled form.
Yeah, even nasal sprays like ketamine.
Well, yeah. Right. Well, that's true. Yes, of course. But so when done properly, that can be something really effective. The question about inhaling medications, even an insulin as a vapor, is does it cause any inflammation in the lungs? Because what you don't want to do is take it for 20 years and then end up with
lung cancer.
Yeah, lung cancer or pulmonary fibrosis or something like that. So still taking it orally is going to be the way to go. Anyway, all right. This is a weird question here.
Hey, Dr. Steve, it's Calvin from California.
Hey, Calvin.
I was wondering, they had that recall on Jif peanut butter, and it was recalled for salmonella.
Yes.
What if you boiled the Jif? Do you think it would kill the bacteria? Or is
Yes. But can you imagine? Well, instead of taking it back to the store and getting another bottle or whatever jar of Jif, I'm going to boil it. Can you imagine the stink?
one of those thermophilic ones that would just really dig and get down with being so hot?
Yeah, it's not. Salmonella is not thermally stable. It would kill it. Yes.
A friend of mine had a guy come visit her, and he didn't think that Jif was everywhere. So he brought his own bottle of Jif.
Oh, he thought it was local?
He brought his own bottle of Jif in the suitcase.
Oh, my God.
Oh, my word.
And he told her that he did
Bless
that?
it.
Yeah.
Bless it.
Bless it. Bless it, God. Bless it.
That's odd. Where was he from?
If you think real hard, Steve, you'll get it, but we can't say the name.
Okay. All right. Fair enough. Okay. Yeah, it's hilarious, and it's one of those things that is just going to have to remain a mystery to our listeners.
But yes.
Hey, what's up? Love this show.
Oh, that's okay. Yeah. So, and then his mistake was, I brought my own jar of Jif. Just, if you're going to, and well, he didn't know it was weird.
How bizarre.
I didn't figure you all a puree of peanut butter.
Up here.
We got this stuff called peanut butter where I come from. Okay,
He's ass backwards.
Yeah.
This isn't necessarily a medical question, but you all have a good opinion on things. I want to get your advice.
Okay.
From this Epi and Anthony show. Love your show, both of you doctors. But what do you think about House the Water guy? These douchebags. You're swimming in a pool. It could be a guy or girl. House the water. What the fuck do you think? What the fuck do you think? I'm in the fucking water. It must be fucking terrible if I'm in it, right? House the water. House the water. Tell me what you think of these fucking assholes. What would Anthony think about that? Anthony hated the till. What he got, the till. Stop saying till. And one day Jim Norton would say cobbler. Anthony said, you're going to need a cobbler to get my foot out of
Okay, I know. It's his body. This guy was on a tear. Yeah, I'm not a comedian, and it's been established I'm not a funny person. But that is, just ignore them or say it's wet or one,
Well, it's an interesting point.
Or fuck around and find out or something. What would you say to somebody? How's the water? It is idiotic. What they're saying is the water cold? Mm-hmm. Do you perceive the water to be cold? That's how I would ask someone if I wanted to. Just as if...
Then you would sound like a big nerd.
Sure.
Do you perceive the water to be cold?
Well, and that's the thing, is so you go, how's the water? And that's what you're saying. It's like when we went to Star Wars Land and they were selling these spherical bottles of Coke And I walked up to the guy and I said, how many credits for an orb of liquid refreshment? And he went, that would be 3 credits. Okay, well, now I'm one of those guys. And the kids were like covering their faces and just shaking their head and looking at the ground. Tacie was laughing. I thought it was funny. It was funny. Fuck all y'all.
Those poor boys, those poor children.
All right.
They're rotten.
Yes, they are rotten.
We answered this one.
Hey, I got a question for you. I'm in my mid-40s, and it seems like after I have either intercourse or rub one out, it seems like it takes about a half an hour or so, but it seems like there's almost like it started to get a kind of a burning sensation, almost kind of like
This isn't the same question, but we get this question very frequently.
plug in a way, and then it just gradually gets a little worse, and I have to finally go in and sit on the toilet and kind of push it out, but not a whole lot comes out, but it seems to clear it up. This has happened on and off for 20 years.
Yeah. Yep, and I hate that he's been suffering for 20 years because we had the answer to this on maybe like the 3rd show we ever did back in 2007. Do you guys remember what this is?
No.
Urethral spasm.
Give yourself a
Put it
bill.
on a bored baby.
Oh.
Yep.
You know, I've read a lot of shit this show.
Mm-hmm.
I've said a lot of shit this show, and I got one.
You got
Give
one.
yourself a bill.
Damn it, no.
You got a bell for saying you didn't get
one
it.
earlier. That's
All
3 to 2.
I have to do is bitch about it.
Well, you got a bell for saying you didn't get any bells.
Yeah,
so that's correct.
yes.
No, you got one.
She did got one earlier.
Now you got
it's,
2.
It's 3 to 2. 3 to 2.
Anyway,
Damn it.
take your junk and dip it in warm, not hot water. And this will go away. This is spasm of the urethra, and for whatever reason, just the warmth of the water, but God, not hot water, just warm water. If you have to have a little bowl or a glass or something, you can just
Leave it by your bed.
dip your junkal region in it, and it will completely go away. And it's mostly penis, because it's the urethra is the problem. But anyway, all right. Thanks for calling. Dr. Scott, you have any questions from the waiting room? Or
Yeah, our old buddy Colin Carnes has a good one.
Okay.
He's talking about his mama, sweet mama, having some hot burning pain in her feet so bad. In fact, she feels like she needs to put him in ice water. She's 66 years old and just was wondering if we had any ideas of what may have caused or maybe some treatments to consider.
Sure. Well, you know the answer to this.
Yeah, it sounds a whole lot like she's got some neuropathy in her feet.
Yeah.
So a neuropathy is just nerve-related pain. It can be caused by a number of things. You want me to run through them real quick?
Yeah.
Yeah, a couple
sure.
things. It could be considered iatrogenic, so it could be secondary to medicines, chemotherapy agents, statin medications, cholesterol medications, and some others can actually cause neuropathies.
Right.
Number 1. Number 2, diabetes can cause neuropathy in feet. Number 3, you can have a thing in your spinal cord called a stenosis. And there's a narrowing of the canal in the stenosis. And if it's on both sides, both feet, typically we'll think it's a stenosis.
Yeah.
If it's just one side or the other, maybe it's something along that chain. Maybe it's still in the back, but maybe
You could have a
somewhere down the
stenosis,
leg.
but a different part of the
Right. And not shoot down both sides.
Right, that's
Yeah.
right. Well, you can have spinal stenosis, which is the canal.
The middle of the canal, the
and
center
then you
part,
can
yeah.
have foraminal stenosis, which is where foramina is just means hole, basically, where the nerve root passes through.
Yeah,
so
it
you
comes
could-
out of the spine,
Then it'd be
goes
one
into-
side more than the other, or
Right on.
one side solely. So, yeah. So she needs to get that checked out. I would recommend that her primary care see her for that and do a complete evaluation. They could do some neurologic tests just to see if she has hyperalgesia or allodynia, which are signs of a
hypersensitive
nerve
pain, yeah.
neuropathic type syndrome, where you do very light touches or something that's minimally painful where it's amplified, or you get pain with very light touch that normally wouldn't cause pain. And then they can also do a test for sensitivity to touch, and they can see if maybe she's lost some sensitivity. And then there's also tests for a thing called proprioception, which is where you lose the ability to determine where joints are pointing and what position and space they're in. And that's all of that information is sent to the brain through nerves. And when the nerves are damaged, it can't get that information anymore.
Yep.
And one of the unfortunate things about neuropathy is if you get primarily numbness in the feet, you can get Charcot feet, where the bones start to break because when you injure your foot, you don't favor it anymore and you just keep injuring it. Yeah. Or you can get what she's got, which is you get this sort of tingling pain, which we call paresthesia. It feels like pins and needles and stuff. Mine feels like if you imagine a pin cushion, but all the pins or the sharp points are sticking out. And then you take that pin cushion and rub it all over the top of my toes. That's what my neuropathy feels like when it's bad. And because of some nutritional supplements, which are on the website at drsteve.com. If you can't find it, let me know because I'm redesigning it and it's in the middle of it right now. And some links have gotten lost, but let me know and I'll send you some info on some nutritional supplements. You can also go to stuff.drsteve.com and just scroll down. I've got all the nutritional supplements that with some data that, none of it's great data. Nobody's doing, multi-center, double-blind, placebo-controlled studies on these things because they're not going to make any money off of it.
Exactly.
That is one of the issues. I get it with medicine the way it is, when it's being driven by profit. But that also gives us all kinds of great innovations, too, so it's a double-edged sword. But there is some data on these things. You can just go there, stuff.drsteve.com, and just look for the bottles of nutritional supplements. And if I remember correctly, I put all the studies there as well. So, yeah.
And I was going to say, too, the treatments for your mom's foot pain is really going to be dictated by what the underlying cause is. Yeah,
that's right.
If it's a drug, sometimes stopping the drug will make it better. If it's a disease, sometimes a medication for disease. But if they're not for sure, things like sometimes they'll do epidural steroids into the spine. Yeah, and it'll calm things down. If it's a stenosis, depending on what it was. Sometimes the acupuncture helps. Sometimes massage. There are a number of things that can help.
Multifaceted approach.
It's pretty
challenging. One of the tests
that
they could do to see where it's coming from is a thing called an electromyogram with a nerve conduction velocity. No, you
do that last.
Well,
yeah,
you do it if they can't figure it out. But
no, I know.
That will tell you if there's a nerve that's being compressed somewhere. It'll tell you if it's a polyneuropathy or a mononeuropathy multiplex, which is a lot of diabetics will get that, where you have a bunch of different single individual nerves that are all being damaged, but they're being damaged separately by the same insult. So anyway, and then let us know what they find, because there's lots of treatments for it too. Duloxetine is the drug of choice for neuropathic pain, and it is also sold as an antidepressant called Cymbalta, and it just has two different effects. They're similar, but they're different, just like aspirin is good for an ankle sprain, but also good to prevent heart attack and stroke. Duloxetine is good for neuropathic pain, but also for depression. So there you go. And then methadone is an opioid that sometimes if you have completely refractory and you can't stand it and nothing has worked, you've tried gabapentin and you've tried pregabalin, you've tried the duloxetine, you've tried everything else, then the very last resort would be methadone. And methadone is the only opioid on the market in the United States that also attacks the root cause of neuropathic pain, and which is the N-methyl D-aspartate receptor. Don't worry about that. There won't be a test afterward, but it will antagonize that receptor, and that is responsible for sending the signals of hyperalgesia to the brain that we've already talked about. All right? You happy? All right, let's do this one. This is a good one.
Hey, Dr. Steve, Dr. Scott, Tacie.
Howdy.
How are you guys doing?
Good. Hey, Lydia got her first shout. She's not here.
So I've recently got one of these fitness trackers that also tracks your heart rate, and I've been wearing it to bed, and I've noticed almost every night, not every night, but almost every night, within an hour or two of falling asleep, my heart rate peaks to 160, which for me is about the same as it is when I'm, at peak cardio, but it's just momentary.
Yeah, he sent me a copy of what his watch is printing out, and he's got a normal sort of hammock-shaped heart rate. It should be higher when you go to bed, then drop, and then raise back up again in the evening. It should look sort of like a hammock.
Gotcha.
And his is doing that, and then right a little past the middle of that sleep cycle, he gets this huge spike up to like 170, and then it comes right back down again.
Okay.
And then it goes right back down to like the low 60s or 50s, which is where it is the rest of the night when I'm sleeping. Listening to your show, I think it might be one of these hypnic jerk episodes.
Yeah, I don't think so.
Which I didn't really know I had. And it's weird that I thought those happen like when you're first falling asleep. And this
They are, which is why I don't think that's what this is.
seems to be around 1 a.m. in the morning, which for me is like 2 hours into sleeping.
Yeah, I'm going to give him a bell, though.
Give yourself a bill!
For knowing that that wasn't probably it.
Just like I said, it's momentary, goes right back down.
Yep.
I don't think it's sleep apnea or anything like that. I feel well rested and awake in the morning, but just never knew. Well, is there anything to be concerned about? Do you think it's one of these hypnic jerk episodes?
Yeah. So you could not have sleep apnea, but still have sleep deranged breathing, And if you do, these kinds of episodes are associated with that. So when you get up into the 170s, you're thinking arrhythmia. Mm-hmm. And arrhythmia just meaning a rhythm other than a normal rhythm. Mm-hmm. And it's all on him. It's always limiting. It happens and it comes right back to normal. They did a sleep heart health study where they looked at people for paroxysmal atrial fibrillation. That means irregular heartbeat and it can have a rapid heart rhythm that just comes and goes. Okay. It's not there all the time. And what they found was that these episodes were associated with disordered breathing in the middle of the night. So a couple of things I would want to know is, number one, is this associated with any sleep phase? Because, that watch you have will tell you if you're in REM sleep or if you're in deep sleep when this happens. Also, some of the watches will look at your oxygen level, and that's not very accurate, but it's accurate enough. Is it dropping right when this happens and then your heart rate goes up? Because that could be evidence for sleep deranged breathing or whatever, the SDB. So sleep disordered breathing. So what I wouldn't rely on that, though. What I would do is two things. And the one they could combine into one. You could get a Holter monitor. And a Holter monitor is a thing that you wear, and you would wear. In his case, he would wear it to bed, and it will record 100% of his heart rhythm episodes, or every heartbeat, and it gets like an EKG tracing. And then if it happens, they can say, yeah, this is atrial fibrillation, it's atrial flutter, it is ventricular something, this, that, and the other, supraventricular tachycardia, whatever. And if it needs to be treated, fine. If it doesn't, if it's considered benign and self-limited, then they'll just leave it alone. The way that they could combine all of these things would be to do a sleep study, okay. A polysomnogram, and you lay down in the place at night, and they put an EKG on you, and they put all kinds of different monitors on you, a spring around your chest to determine when you're breathing and when you're not breathing, and they monitor you every which way, up and down, even an EEG they can do. And you sleep, and you hope that one of these things happens while they're watching you, and then they can determine what it is. The big thing that increases the odds, of course, is the frequency of this. If you're noticing this every single night, then the odds are they'll be able to catch it doing one of those two things. Okay?
Right on.
So that's what I would do. All right. But I wouldn't dick around with it. You seem fine. Mm-hmm. There are some weird conditions that can cause nocturnal arrhythmias that aren't fine, but if you catch it now, they can take care of it. It's treatable with medication.
Cool.
So just go get it checked out and then let us know what they find, okay?
Cool.
All right. Got anything else?
I believe I'll do her.
Tacie?
Nope.
Well, all right. Well, maybe I do have something.
No, you better not.
No,
Thanks.
It's jam time, baby.
Is it? We go jam a little bit at the
Yeah,
end.
we'll play something.
For people who don't know what we're talking about, if you hang out with us in the YouTube, you get
If
to
you're lucky enough.
Yeah, you get to be tortured by us doing music afterward. And rather than learning songs and then playing them for our audience after we've figured out how to play them, what we do instead is we learn them while people are watching us, and then we practice them and then play them well for each other. It's the stupidest, most ass-backward thing. It's idiotic.
Yes, it is.
So we should probably do a concert for them at some point so they'll understand that we actually do know how to play some songs okay.
Yes.
But what we're going to be doing today, Tace, and you may not want to go downstairs, is we're going to be doing...
I'm good.
We're going to be learning Bo Daddy Harris's...
Oh, no. That's good.
Queen of My Heart.
Oh, yeah.
Yep. And so I spent an evening figuring out the structure of this song, transcribing it, and the longest thing was trying to figure out what the words were. And then I asked him, he said, well, just Google it. So I Googled it, and there's a place where the lyrics are after 2 hours of trying to listen to this.
Steve,
Well, they're
you
not
didn't know
right.
that?
Yes, but they're not
They're
right.
inaccurate, yeah.
No,
they're not
wrong.
right?
And
They're wrong, too?
He put them up there, I think, and they're not right.
Oh, my Lord.
I'm telling you, if there was any market for a show where you would go through a Bo Daddy Harris video and compare it to the lyrics that he put up there, I would, by God, do it because it'd be hilarious, but it's not right. Anyway, Bo Daddy, I love him. We love him. So that's what we're going to do. Anyway, so we're going to do that. And if we get anything, if you want to actually see me do this live, come to Dabble, I guess that's what it's called. I don't know what it's called. The event in Rochester, February 3rd. There's going to be a comedy event. There's going to be live podcasts done, and there's going to be an award ceremony. February 3rd through the 5th. Go to WATPlive.com. We're going to have a table and some merchandise there, and we'll just say howdy do, and, heck, I'll buy you a beer or whatever if you come say hello.
You better not.
Why?
You can't be buying everybody beer.
Why can't I not?
Because
Do you know how many I bought last time when I said that?
Oh, I don't even want to know.
That was like 6. It was no big deal.
Okay, all right.
That'd be like one night. That'd be like one night out with me.
Yeah, there you go.
There you go. See, he saves money.
Okay.
He's not taking me.
It's fine.
Mm-hmm.
It's fine.
It's fine.
And Tacey's all worried because she's not working that we don't have any money, and it's like I can buy a couple of people some beers if they. Most people won't come up and and even say hello. I had one guy that said I was too nervous to come talk to you, and it's like, oh, come on, it's me. It's not. I mean, I don't even be too nervous. I wasn't too nervous to go talk to Harlan Ellison or Ray Bradbury at Dragon Con, and those were two of my true heroes, and they're true heroes to a lot of people. Absolutely don't be nervous to come and talk to my dumb ass. So, Sean and Amanda will tell you. All right. Anything else? Is that it?
That's it.
All right. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Oh, by the way, get tickets at WATPlive.com. I'm a dumbass. I'm the worst plugger that ever lived. Right, Tace? Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. And don't forget Dr. Scott's website at simplyherbals.net. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.